Hi there. Okay, so this is my advanced ortho practical video, and before I do anything, this is my patient Madison, so you can wave.
Hello.
I want to make sure that she is clear for all contraindications and precautions, so I'm going to go ahead and perform a vertebral artery test on her really quick. So what we're going to do is come over here. We're going to move our therapy dog out of the way. She's unhappy with me. And she's gonna go ahead and lay her head all the way back and go ahead and scoot towards me a little bit. In an ideal situation, I probably wouldn't do this test with her head hanging off of the bed, just in case something did happen and I had to go get help, but due to COVID and these circumstances, this is the best surface that we have to do this. So I'm gonna go ahead and have her scoot to the end so her head is in my hands, and go ahead and just scoot up a little bit towards me. Awesome. Is your hair okay?
Yes.
And I'm going to go ahead and go put her into passive extension like this. And then I'm going to talk to her. Are you feeling okay?
Yes.
And I'm going to go ahead and rotate her head to the one side. And I'm going to keep talking to her. How are you doing today?
I'm doing good.
Good. And I'm going to look for nystagmus to see if her eyes are good. And I would hold this for about 30 seconds, but for the purpose of the video, I'm going to go ahead and do the other side. And I'm going to go ahead and keep the communication. You doing okay?
Yes.
Who's the president?
Trump.
Oh, that's a good question.
Yeah.
Okay. What day is it today?
December 8th.
All right, awesome. So she's all good, and then I would take her back, and you can go ahead and sit up. So she would be cleared to do the techniques for manipulations and things like that. So we have that one out of the way. Is a muscle energy technique for a joint rotation. And the first thing that I'm going to do is have her try to rotate. So you can go ahead and rotate to your right for me. And that looks pretty good. Can you rotate to the left? And how does that feel?
It hurts.
Yeah, so she's having some pain and some obvious restriction there towards the left. So the next thing I'm going to do is just kind of assess that with some passive mobility tests. So I'm going to go ahead and ask her to lay all the way down. You feeling okay?
Yes.
All right, and we already cleared for those contraindications and precautions. I'm going to go ahead and flex her to end range where she can't go anymore. And that's about end range there. I'm then going to rotate her. You feeling okay?
Yes.
She's definitely restricted on that side. Much more on that side, making sure I'm keeping her in that end range. And she does have some restriction there. All right, so I'm gonna go ahead and ask her to sit back up real quick. So for the muscle energy technique, I'm gonna have her lay all the way back down, put her in that position. So the next thing that we're gonna do is actually do the muscle energy technique for AA rotation. So I would go ahead and have her in a flex position, and I would have her rest her head on my abdomen. In a COVID-free world, we would have her on a PT table, but we have to make it work with this bed for now. I'm gonna make sure that she's in that end range, put my thumbs on her zygomatic processes, and cup her occiput with my other fingers. I'm then gonna move her into a rotated position, making sure that she's in that end range flexion, and that's about her restriction there. So I'm gonna ask her to try to rotate to her left, and I'm gonna be pushing towards her right, so don't let me move you, okay?
Okay.
Hold for about 6 to 8 seconds. And then relax, and I'm gonna try to rotate her a little bit further, and she got a little bit more. And go ahead, don't let me move you. And relax. So ideally those would be 6 to 8 seconds, and I would dose that 6 to 8 seconds 3 to 5 times. And then go ahead and relax just for a second. I would reassess with those passive mobility techniques. So I'll go ahead and have her in end range flexion again, with her head on my abdomen, making sure she's in the end range. And I'm getting more motion on that side, and she had normal motion on the right to begin with. And then go ahead and sit up for me. And can you go ahead and rotate to your right and rotate to your left? And how does that feel?
It feels better.
And a little bit more motion there as well.
Action.
So the next thing that we're gonna do is a prone cervical, mid-cervical PA manipulation. And I have my same patient here who we've already cleared all the precautions for. So we are going to go ahead, and she's having some pain with movement. So I'm gonna go ahead and ask her to rotate her head to the right. And how does that feel?
It hurts a little bit.
All right, and rotate to the left. And how does that feel?
Still a little bit of pain.
Kind of like general pain, not really limited due to stiffness. So I think prone cervical PA manipulation is a good choice. So we're gonna go ahead and have her lie on her stomach with our makeshift plinth here. Obviously in a COVID-free world, we would have a more appropriate place for her to lay down with a face hole, and I would have raised the table up so it'll be a little bit more of an appropriate height. I'm gonna do the best I can with my body mechanics to accommodate. I'm gonna go ahead and have her head in as neutral of a position as she can get. I'm gonna go ahead and palpate for her occiput and come down until I find that C2 spinous process. Scoop the soft tissue. You okay? Go ahead and relax. Scoop the soft tissue there. So I have my 3 points of contact there on the sides of her neck and on that C2 spinous process. And I'm gonna not hyperextend my thumbs and keep my line of force as straight as I can. And I'm gonna do some spring tests. Does that hurt?
No.
Does that hurt?
Yes.
All right, so that's a tender segment. So now that I've found that, I'm gonna go down one more just to see. That one feel okay?
Yes.
All right, so it is gonna be that C3 there, so the mid-cervical. And I'm gonna go ahead and palpate for that process again, make sure I don't hyperextend my thumbs, and I'm gonna do a pushing and a pulling motion.
Yep.
So now that we've done those oscillations, I would dose that at 6 to 8 seconds, 3 to 5 times, depending on her irritability. I communicated with her to make sure that she was good and not having any weird symptoms, kind of making sure she's reproducing that pain with that spring testing. And then I'm gonna have her sit up like she is and have her rotate her head to the right. And how does that feel?
Good.
Less pain?
Yes.
And go ahead and rotate it towards me. And how's that?
Less pain.
All right, so it's kind of a little magic trick there, but she's feeling better. Okay, so the next thing that we're gonna do is a prone thoracic extension manipulation, and it's indicated for non-specific neck pain. So we have our patient here who has complaints of just general neck pain, and to assess her beforehand, I'm just gonna have her do some general range of motion. So can you go ahead and nod your head up and down for me? And how does that feel?
It hurts.
Kind of all over. Can you go ahead and look to both sides for me? And how does that feel?
Still hurting all over.
One side hurt more than the other, just kind of general pain.
General.
So now that we've established that she has general non-specific neck pain, a thoracic mob would be indicated, so we're gonna go ahead and do that. So prior to doing this technique, I would get consent from the patient. I would let them know that I think it would be best to do a high thrust manipulation with them, where you may or may not hear a pop or a cavitation. I would make sure that they were okay with that, comfortable. I might kind of demonstrate and show them what it might look like with my hands beforehand to make sure that they're comfortable and that I got their consent. Go ahead and place her on her stomach and ask her to lie face down. For these purposes, I would have her on an adjustable table. We're gonna make do with what we have here. Okay. So to actually perform the manipulation, I'm gonna have my hands in an L shape using my pisiforms on her transverse processes and my forearms as straight as I can to apply that force. So I'm going to start here by palpating the spinous process of her transverse vertebrae. Come out to the side to find those 2 pisiforms by rolling my fingers over them. Once I have them, I'm going to use those pisiforms of my hands over those transverse processes there. There we go. And I'm going to make sure that my line of force is steady right over her. And I'm doing the best I can with my body mechanics. And I'm going to apply a twisting force as I come down and twist my hands. I can also coordinate this with breath. Go ahead and take a deep breath. And exhale. And we'll come down another one. Take a deep breath in. And exhale. You feeling okay?
Yes.
And how does that neck feel now?
It's feeling good.
A little bit better?
Yes.
Right. So now that we've done the extension manipulation, I'm just going to reassess. So can you go ahead and just nod up and down for me? And how does that feel now?
It's feeling better.
Better? Can you go ahead and look to the side for me? And how's it feeling?
Good.
All right, so her general non-specific neck pain has been reduced with a thoracic mobilization.
Action.
So the next technique that we're gonna do is called the lumbar roll technique for more non-specific low back pain. So I have a new patient here, say hi.
Hey.
And he is presenting with general aching, kind of non-specific low back pain, more so on the left side. So since he's painful on that left side, we're gonna be targeting the force to the right side because it's a non-painful side. So before, just to kind of determine that his pain is non-specific, we're gonna have him just do some exercises just to make sure, some tests. So I want you to stand with your hands on your hips, and can you just lean back a few times for me?
Mm-hmm.
And is that changing your symptoms at all?
No.
It's still kind of the same?
Still the same, yeah.
Okay, can you lean forward a few times for me?
Yeah. Like this?
Yes, just like that. Is that changing your symptoms at all?
Nope.
It's just kind of the same?
Just the same.
So from those centralization and peripheralization tests, we can determine that his back pain is nonspecific and the lumbar roll is appropriate. The most important part before any manipulation is to get consent from the patient. So what I'm about to do may or may not elicit a pop or a crack when you do it. It's not hurting anything. It's just a natural response to the manipulation. Are you okay with that?
I am okay with that.
Okay. So because he said he was having some pain in the left side, we're going to be targeting the force of this maneuver through his right side. So I'm having him lie on his left side, and we're going to make sure that his hips and knees are in alignment here, which they are. And then I'm going to go ahead and take his leg and hang it off the side of the bed about 3 or 4 inches. So that should be sufficient there. And then I want to just check out his alignment and make sure that everything's good. So I'm going to take it, kind of cup his ankle, kind of feel for the alignment back here, make sure that I'm in the straddle stance, and we're just gonna rock back and forth. Are you doing okay?
Mm-hmm.
Just to kind of see what's going on and just generally assess what's happening. Once I kind of have that feel there, I'm gonna hook his foot behind his knee, and we're gonna pin down his knee with my leg, and I'm gonna switch to a stride stance here. So now that I have that, I'm going to move his top arm out of the way, and I'm going to take his bottom arm, place it in my armpit. Are you feeling okay?
Mm-hmm.
And I'm going to pull on that to kind of give him some rotational force there while keeping his leg pinned down. And once I feel like he's maximally rotated, all right, go ahead and cross your arms for me. And I'm going to weave my hand through the back here. And I'm going to kind of not lace my hands, but I'm going to make sure that my elbow is kind of in that deltopectoral groove of his. So now that I have him in this position, I'm going to keep my hands on his back and do a kind of a quarter turn and use my arms as a fulcrum to get that stretch. And we'll hold for about 6 to 8 seconds. Okay, you feeling okay?
I am, thank you.
Okay. Yeah. If it wasn't COVID, I would have him on a more appropriate height table for me. So I could have dosed that as a high thrust maneuver, but because he was painful on that left side and I was just kind of testing the waters today to see how he was going to tolerate the maneuver as a whole, I decided to go with the stretch. So after this session, compared to how you were feeling before, how do you feel now?
I feel much better now.
So upon reassessment, the lumbar roll worked and the patient is better. Okay, so the next thing that we're gonna do is do a muscle energy technique for a right posteriorly rotated innominate. So this is my patient here, and she's having some SI pain is what we think, but she's just having some general pain in her lower back area. So the first thing I'm gonna ask her to do is just point to where it hurts. And she's got a pretty specific place where it's not non-specific, she has a pretty localized place. And go ahead and relax. Can you try to point one more time for me? All right, and it's the same place. So she does have a positive Fortin finger test. The next thing I'm going to do is some provocation tests just to determine that we are dealing with SI pain and not lumbar pain. I'm going to go ahead and have her lie on her back on the bed here. We can go ahead and stay on this side for now. And are you comfortable?
Yes.
Okay, so what I'm going to do is put my hands kind of in this area. I know it's a little bit uncomfortable, but we'll just kind of communicate with me so we can keep the good communication, and I'm not going to do anything that you're not comfortable with, okay? The first thing that I'm going to do is place my palms right here, cross my hands, and I'm just going to give you a little bit of pressure, okay? Okay. Does that hurt?
Yes.
Yeah, all right, so she has a positive test there, and I'm going to do the same thing. This time I'm going to be pushing them towards, okay?
Okay.
And how does that feel?
Yeah, hurts.
All right, so she has positive provocation tests as well. So now we know that it's SI pain. Just to confirm whether it's a posterior, anterior, rotated innominate, what I'm gonna do is come around here, and I'm gonna do a supine to sit leg length discrepancy test. So I'm just gonna go ahead and have her bridge up for me. Good, and then come back down, and I'm gonna assess that. And we can see that her right leg is shorter right now. I'm gonna go ahead and ask her to sit up for me. And now we can see her right leg is a little bit longer in sitting, and it was shorter in supine, so that confirms that she does have a posterior rotated innominate on the right leg. Ready? All right, so now that we have confirmed that she has a posterior rotated innominate on the right leg, we're gonna go ahead and do the muscle energy technique for it. So I have her lying in supine and I'm standing on the side to be treated, which is her right leg. I'm gonna go ahead and have her flex her other leg up to about here, and I'm gonna apply a pressure force here and here on her legs, and I'm gonna ask her, I'm gonna try to put pressure down, and I don't let me move you, okay? I want you to push up into my hand. Ready? Go. Hold for about 5 seconds, 5 to 6 seconds, and relax. All right, so the dosing for that should be about 5, 6 to 7 seconds, 3 to 5 times for the muscle energy technique. To assess, I'm gonna ask her how she's feeling.
Feeling good.
You feel like you maybe have a little bit less pain in that SI area?
Yes.
All right, just to confirm, I'm gonna redo those provocation tests. So I'm gonna just do those same little pushing tests. Is that okay with you?
Yes.
All right, so feel there. How does that feel when compared to the first time we did it? Better. All right, I'm gonna do the second one. And how about that?
Definitely better.
A little better? All right, so she's feeling better and the muscle energy technique worked. If those muscle energy tests for the SI didn't work and she was still having pain, I would follow up with some spring testing to see, and some PA mobilizations to see if that would help.